Hello guys! So this is our second discussion in our laboratory for parasitology. So today class, we're going to learn about stool examination. So class, stool is a very important specimen that is brought in the laboratory. Class, everyone, class, most probably have submitted, hopefully have submitted stool. Yan, stool in the laboratory. So sana kayo is nagpa-stool exam na kayo at one point in your life. And class, stool exam results are very important in clinical investigations. Not only we could detect or obtain results, whether the patient has parasites or not, but class, it could also reflect the health of the digestive system. Yan. So, class, maraming information ang nakukuha pag ine-examine ang stool. Yan. So, class, we will go through how we do physical exam in the stool, chemical exam, microscopic exam, and the different methods that are related with your stool exam. Yan. So class, so the primary specimen that we test on is your stool or human feces. Basically class, your stool contains indigestible materials. So expect that if you're going to focus it under the microscope, you will find fibers. Yan. You will find different food materials in the stool. Yan. So class, what are the composition of stool? It has water, it has different solids from the food, so protein, carbohydrates, fats, undigested and unabsorbed food materials. We have intestinal secretions. We have mucus, bowel pigments, and salts. So the one that gives color to your stool is your stercobilin. Yan. So stercobilin is from your bile pigment. What else? We have bacteria, inorganic material, epithelial cells, and leukocytes. So these are the things that we commonly find in your stool. So of course, if there's a parasitic disease, may parasite. So class, so today, anong mga gagawin natin? So we have physical or macroscopic examination. So we will find the consistency of your stool, kailangan. So class, the consistency or the form is dependent on the water content of the stool. Yan. We have color, the odor, class, the odor of the stool, but we don't record it. But class, odor could be a signal of a disease. We have blood, we have mucus, yan. So class, we examine the stool macroscopically or using our naked eye only. So class, I hope that in the process of us learning about stool examination, that I hope that you're going to apply it in your life as well. Na once you, make number 2, that you won't immediately flush your stool, but observe it, yan, because it could reflect the health of your digestive system, yan. We also have chemical tests. So the common chemical test that we do in the Philippines is occult blood. Yan, occult blood. So when we say occult blood, occult means hidden. So some of the blood that some people have occult blood, meaning blood that is not naked, that is not seen by the naked eye. So it's hidden. Yan. So hindi siya ganun karami eh. So, ayun, class. So, we could detect it chemically. We will also discuss microscopic examination, our wet preparation, our cathodic smear, and our concentration techniques. Yan. Staining methods, class, to follow. Kasi medyo mahaba na rin ng staining methods. Yan. So, let's start with physical examination. So, first is the form and consistency. Normally, class, soft to form ang consistency ng stool dapat. So, however, ito, class, so we have this modified Bristol stool scale and it shows the different consistency of water of stool, which is dependent on the amount of water that's present. So, we have watery, yan, watery stool. We have number 4, there are bulgy pieces with irregular borders. In the sausage or snake or soft and smooth, yan, number 3. Number 2 is in the form of sausage but lumpy. And number 1, separate firm lumps like goat stool. Yan, especially if the patient is constipated. So the stool is very dry. Yan. So the modified Bristol stool. Yes, class. Yan. Tae talaga ang usapan. Okay, Larry. Let's start with the different variations. So very soft and watery. So usually seen in patients who have lower bowel movement, diarrhea. Yan. Letter B, excessively hard and sibalous. Maybe due to constipation. Class, we have rice water stool or rice watery stool. So this happens when the patient has cholera. So rice watery stool is caused by a bacterial infection, by Vibrio cholerae infection. What else? We have pea soup stool. So pea is usually color green. Yan. So in typhoid infection, we have flattened or ribbon-like, observe your stool in cases of syphilis, spastic colitis, obstruction of the lower portion of the colon. Yan, class, if ilang araw na, iba yung shape talaga eh. Ang ninipis ng mga stool mo. Yan. So, pwede ka na magpa-check up. F, butter-like. So, fibrocystic disease of the pancreas. We have gaseous and fermentative excessive carbohydrate fermentation. Now, class, the color naman. Yan. So, class, yellow, usually when the babies are still exclusively breastfeeding, usually pag babies, yellow talaga ang stool na may expect mo. Yan, sa diaper nila. And class, santonin. So, santonin is a antihelmintic which makes your stool color yellow. Senna. So, senna, class, you have to read kung mahilig kayo ng uminom ng mga weight loss tea, class, weight loss tea. So, class, may mga weight loss tea na ang ang main ingredient nila is senna leaves. Senna leaves. Yan, senna leaves is a laxative. Yan. So, class, read. So, if you're into weight loss, fads, kung mahilig kayo magpapayat, ganyan, kung ano-anong iniinom nyo, please look at the ingredients. Yun. So, yun, weight loss daw. Kiniklaim nila weight loss. Laxative lang pala yung kaya ka pumapayat kasi nawawalan ka lang pala ng tubig kasi binagyan ka lang pala ng laxative. So, you have to be careful, guys. Okay? Next, we have light clay or putty color. So, every time you have barium meals, so barium meals are diagnostic tests to diagnose your esophagus, digestive system. In cases of intake of barium enema, lack of bile, ayan, so isn't it that the normal color should be brown? But since you don't have enough bile pigments or there's bile blockage, your stool has no color. So it was not able to be oxidized into stercobilin. Yan. So class, here is a photo for barium enema, barium meals. So they give barium meals to patients, and after x-ray, so the digestive the part that they want to check is more visible. So class, we also have reddish or bloody. So these are blood which are seen by the naked eye. So usually, class, ito bleeding in the lower gastrointestinal tract. So tignan nyo, class, kung may dugo yung stool nyo. What else, class? Undigested beets and tomatoes. What else, class? If you will eat dragon fruit, yan, pwedeng mag-red yung poops nyo. We have dark red or chocolate brown. So, bleeding in the upper gastrointestinal tract and black and tarry. Yan. So, it's already dark because it was already digested. Yan. So, yung mas black actually, I think mas maraming amount of bleeding ito. Yan. So, yon class. So, black or tarry stool, we call it melena. Yan. And class, usually, when the stool comes in the laboratory, tapos green siya, tapos mucoid siya, most probably it's amoebiasis. Yan. So time and time again, every time I'm receiving mucoid stools and it's green, usually it's positive for amoebiasis or entamoeba, histolytica. Yan. Okay, for the odor. Yan. So class, extremely foul odor are due to your protein, excess protein. So class, sabi niya, normally, the odor of stool is foul to offensive due to indole, scatol, and butyric acid, bacterial fermentation, and putrefaction. So class, everyone, yan, expect nyo na every time you're going to receive a stool, yan. So it's foul to offensive and color class. That's just how the way it is. Yan, sanayan lang talaga. Yan. Pero minsan kasi nga class, nakakainis, kumakapit talaga sa damit yung amoy minsan eh. Yan, yun lang mahirap class sa parasitology. But class, kahit crush mo pa yan, kahit artista pa yan, lahat, almost all stool specimens have foul to offensive odor. Yan. So class, yun, putrid odor can be due to ulcerative or malignant tumor of the lower bowel. So class, my friend says that people who have cancer, yan, cancers sometimes would result to necrosis of the tissues, dying of the tissues. So if the tissues are dying, yan, expect it to smell. So if you have cancer in the colon, ganyan, tapos yun nga, some cells are dying, some tissues are dying, so expect that it could be extra smelly. Yan. Sour or rancid. Sometimes the feces of babies could smell sour and rancid because of breastfeeding. Yan. Gas formation, fermentation of carbohydrates and unabsorbed fatty acids, and extremely foul. Yan, due to proteins. So, chemical examination na tayo, guys. So, class, the main thing that we examine chemically is your fecal occult blood. So, these are blood that cannot be seen by the naked eye but only detected by chemical means. Yan. So, class, we have two main tests. We have benzidine test and Guava test under your FOBT or occult blood test. Yan. Kasi sa hospital class, minsan tawag FOBT. So, class, benzidine test is actually obsolete already, or HEMA test, because of its excess sensitivity. It's so sensitive that there's so many false positive that once you will eat meat products, yan, pwede kang maging positive. So, obsolete na tong benzidine test. And what's worse is benzidine as a carcinogen. So now, what's accepted is your Guava test or hemo occult slide test. Yan. The principle of your hemoglobin FOBT class is your the peroxidase action of hemoglobin in blood converts hydrogen peroxide to water. Yan. This oxygen oxidizes guaiac in acid medium to 4 green. Okay. Peroxidase activity of hemoglobin in blood converts hydrogen peroxide to water and oxygen. Yan. So, ba't walang water dito? So, the oxygen oxidizes your guaiac reagent, and so once the guaiac is oxidized, it will turn into blue. Yan. So, andito na yung water. So, class, yung hemoglobin nyo has peroxidase activity. So, class, here, yan, this is the Guava test that we use. Actually, nasa paper format siya. So, what you do is, andito, collect a small amount of stool specimen on the applicator. So, you're going to get an applicator stick, get a stool specimen, and smear it. Yan. Make a thin smear on A. Yan. Sa box A. Yan. And class, poke the other side of the stool kasi nga hindi mo alam kung nasaan yung yung blood. So poke the other side of the stool and smear it to letter B square. Yan. Then after that, you will drop a developer. Yan, magda-drop ka ng developer dito sa mga squares natin. Then close it, then flip it. Ito na yung sa likod, flip it. Yan. So after a few minutes, class, expect a blue chromogen, so the oxidation of guaiac, once there is hemoglobin in the stool. Yan. So, positive positive kasi blue. Yan, blue. So, class, occult blood, positive, may be due to ulcers, diverticulitis, ulcerative colitis, adenoma. Class, so adenoma are tumor from the glandular cells. We have cancer of the colon. We have diaphragmatic hernia. Yan. So, class, Guava Test, FOBT, or occult blood test, pare-pareho lang yan. Okay. So, class, if there is excess fat in stools, we call it steatorrhea. So, these are just the examples of diseases wherein you could have fat in the stool. So, obstructive jaundice, celiac sprue, pancreatic disease, Whipple, cystic fibrosis, Crohn's disease, and if there is a removed section in the intestine from surgery. Yan. So class, the pH of your stool is 6.9 to 7.2. So it's fairly basic neutral class. So if there is excess carbohydrate, yan, hindi na-absorb yung carbohydrate, fat, and disaccharidase deficiency, example, lactose intolerant ka. So expect that the stool is acidic. And alkaline, when there is colitis, antibiotic use, villous adenoma. Yan. So, villi are the finger-like projections in your small intestines. Yan. So, finger-like dapat siya. So, hindi dapat ganito. But this has been an adenoma. So, tumor. Yan, naging tumor na siya. And excess protein in the diet. So, class, we are now in your microscopic analysis. Yan. So, class, so pag sinabi ng Chief Medical Technology, okay, prepare me a direct fecal smear or a wet preparation. So, you will make 2. Yan. So, depending on the SOP of your laboratory, usually we make 2. We make 1 saline wet mount and iodine wet mount. So, guys, this is so easy. So, you're just going to get a slide, get a mongo size tool. Yan, 2, dalawa sa on the both ends of the slide, then drop on your left, on my left, your saline NSS 0.85% sodium chloride, and on my right, iodine. Tapos cover it with a cover slip and you're ready to focus it under the microscope. So what can be seen in your saline wet mounts? So basically, you emulsify your stool with saline. So imimix mo siya until homogenized, then place the cover slip. So class, saline wet mount, in we could see worms, yan, bile-stained eggs, larvae, protozoa, trophozoite, and cysts. Not only that, we could also see white blood cells and red blood cells. Yan. So, almost lahat pwede makita sa saline wet mount. Sa iodine wet mount or the Anthony's solution or Lugos solution, because the reagent that we place is iodine, so it could stain the glycogen and the nuclei of the cysts. Yan. So, cysts are the asexual form of the protozoa. So, class, some cells have nuclei, pwede mong bilangin kung ilan yung amount of nuclei nila, or nucleus, and stain the glycogen. So, some class glycogen is the stored glucose. Yan. So, pwede siya ma-stain. This way. Yan. But the motility, so the contraindication in iodine wet mount class, it will inhibit the trophocyte from swimming or moving. So class, this it should supposed to look like this. So you're here naman, inuna niya ilagay yung saline, tapos yung iodine, tapos emulsified the reagents with stool. Yan. So in saline wet mount, you could see the trophozoites, protozoa, ova, and the larvae. However, class, in iodine wet mount, you could really identify the cysts. Yan. So, however, the trophozoites are not moving anymore. Yan. No motility will be seen. Diba? Yan. So, class, in some laboratory, hiwalay nilang ginagawa. Magkaibang slide. So class, these are the things that you're going to see under the microscope. Yan. So, pwede makita yung mga bacteria. Ito, there's our larvae. Ito, may mga food particles. So, you have to be very careful because some food particles or artifacts resembles as parasite. So, next is catho-thick smear or catho-cats technique. Yan. So, instead of using a glass cover slip, the cover slip that we use here is a cellophane that was soaked in malachite green for the last 24 hours. Kaya ang tawag sa kanya, cellophane fecal thick smear. Yan. So, instead of a cover slip, we used a cellophane that was soaked in malachite green for the last 24 hours. Class, you know, thick catho-cat smear are so important, especially in large-scale treatment programs implemented for the soil-transmitted helminthiasis. So, class, you could do this while you are in the field, ganun, if you want. Apparently, you perform deworming in that community, and after a few weeks, you want to test if there are still people who are positive with helminths, soil-transmitted helminthiasis. So, class, soil-transmitted helminthiasis ang best na tinetest ng catho-thick smear. Yan. Not filaria, not tissue roundworms, not blood parasites, but soil-transmitted helminthiasis. So, class, so it is recommended by WHO for the quantitative diagnosis of schistosoma mansoni. Wow, yan, and other intestinal infections. So class, I'll upload a video on how to perform catho-thick smear. But first, class, let's just know the different reagents. So class, I told you that the cellophane strips were soaked for 24 hours. They are soaked in a mixture of distilled water, glycerin, and 3% malachite green. Yan. So they have their own function. Distilled water, it acts as a aqueous solvent. Glycerin, it is the clearing reagent. So it has removed the different unabsorbed food materials, and 3% malachite green could act as both a dye and bactericidal. So it could kill the bacteria around the parasite. So what else, class? Sieve or screen, cellophane strips, newspaper, and the template. Yeah. So figure 1 here, so you need a template, this one. So it's usually square with a hole in the middle. Yan. So usually we place about mga 41.7 grams of stool. So you need a template to standardize your test. Yan. So to standardize the volume of feces that you are placing, if you will follow the template, class, you will place about 41.7 grams of stool, 250 grams. Yan. So once you completed all your materials, you are now ready to screen or to sieve the stool. Yan. So screen or sieve daw yung stool. And after that, class, the sieve stool, you will place it on your template. Yan. So dispose mo na to. And after that, place a cellophane strip on your stool. Yan. Then, after placing the cellophane strip, is flip it the other way around so that you could flatten the stool. Yan. So, flip it yan, on the other side so you could flatten the stool. So, it should look like this. Yan. So, you should flat it in such a way that you could see the print of the newspaper through the slide. Yan. So, dapat sobrang nipis in such a way that you could see the lettering in your newspaper. Yan. So, that's your catho-thick smear or catho-cats technique. Yan. So, class, your catho-thick smear, we have to wait 30 to 60 minutes for clearing time. Yan. To remove the fecal debris. However, class, hookworms are cleared rapidly. Namamatay sila after 30 to 60 minutes. So class, after making the catho-cat smear, you could already scan it for hookworm eggs. Yeah. So what's good is ascaris and trichuris could be recognized for many months. Pwede siyang tumagal. Yan. And schistosoma eggs, you could screen it up to 24 hours. Yan. So class, I'll just give you an idea. So this is your hookworm. Yan. So yung hookworm natin, so letter A is under NSS and letter B is into catocats. So catocats, notice that there is clearing. Mas malinis yung background niya. And next photo is your schistosoma mansoni. Letter A is the malachite green technique. And letter B is the Flotap method. Flotap method. Yan. So, ganyan. Medyo parang, it's already disintegrated. Who's free? So, class, we are heading now to your concentration technique. So, we have two main concentration techniques. We have sedimentation and flotation. So, class, sometimes some of our cysts, some of our parasites, class, cannot be seen in your wet mount preparation. Sometimes we need to concentrate it. We need to aggregate it. Yan. Kailangan natin pagsama-samahin so that we could detect the parasite that is suspected. So it provides the ability to detect small numbers of parasite that might be that was not detected using your wet preparation mount. Yan. So aggregate parasite present into a small volume of sample and to remove much debris. Yan. So the goal of concentration technique is to aggregate the parasite. Yan. Pag i-combine yung mga parasite, and not only that is to reduce the amount of debris, fecal debris. Yan. So that it will not confuse us in the process of microscopy, and it could be performed in fresh or preserved specimen. So let's start with sedimentation and flotation. So class, your sedimentation happens and flotation happens because of the difference in specific gravity. So class, large ova, large parasite tend to stay at the bottom of the tube, tama? Or if the specific gravity is higher than the solvent, then magsisink talaga. And class, your ova, yung mga protozoa mo, it could float if it has less specific gravity than our solvent that we will use. Yan. So the only time that a trophozoite or an oocyst will float if it has less specific gravity compared to your solution. So class, under sedimentation, we have two formalin ethyl acetate sedimentation. Yan. We also have Behrman technique. So pag narinig nyo na si Behrman, strongyloides siya. And under flotation, tatlong i-discuss ko. Zinc sulfate, flotation technique, McMaster technique, and mini Flotap technique. Yan. So class McMaster technique and mini Flotap technique are class great techniques because they could you could really quantitate and you could standardize your performance. Yan. So you could actually assess the fecal egg count per gram of feces. Yung pwede mong malaman. So you could assess the gravity of the infection. Gaano ka-gravid ba yung infestation ng parasite? Yun. So let's start class with your formalin ethyl acetate sedimentation rate. So class, this is sedimentation. So expect that the parasite of choice, yan, parasite na hinarap natin, nasa sediment siya. Yan. So class, actually, yan, you could read, yan, please pakibasa yung mga steps. So class, after doing all the steps, yan, you will centrifuge it. And class, expect that the sediment is at the bottom. The saline or formalin is here. Sa third, so class, pwedeng saline, pwedeng formalin, okay? The bulk of the debris is in the second, and the topmost layer is the ethyl acetate. Yan, ethyl acetate. So ethyl acetate is the topmost. Next is the bulk debris or fecal debris. The third is saline, pwedeng formalin, and number 4 is your sediment. So this is where your larva, your cyst could where you can find them. Yan. Mula na naman. So class, we have also your Berman technique, so sedimentation rin siya. So I like this image, class. So in a funnel, yan. So we have this gauze, and inside the gauze are stool samples, which are connected in a wooden shaft. Yan. So nakahang siya in a wooden shaft, and it's soaked in a um in a water ba kaya to? I think it's water, yes. And yun, so class, the strongyloides larva will tend to migrate at the bottom of the funnel. Yan. So class, this is your gauze. So inside it are fecal samples. So you will tie it to a stick or to dito tongue depressor, and what happens is your larvae, since they are actively migrating, they want to go at the bottom. Yan. So strongyloides usually ang Berman technique. Yan. So nasa flotation na tayo, class. So here, yan. So your oocysts, your protozoa, class, will float if they have less than a specific gravity of 1.18. Yan. Pag less than yung specific gravity nila sa zinc sulfate, class, magpo-float yung mga eggs or oocysts. Yan. So you could change the different floatant solution. So make it a high specific gravity para lulutang yung mga less na specific, may mga less na specific gravity. However, class, the heavy eggs or big eggs, just like your fasciola and your unfertilized ascaris eggs, yan, sa sediment sila pumupunta. So class, if you want to focus the eggs under the microscope, so you will get the topmost layer only. Yan, and that's the one that you're going to focus under the microscope. Class, we also have McMaster technique. Yan. So class, if we have a hemocytometer technique under your hematology class, wherein we quantitate the cells using a Neubauer slide, here we also have a McMaster slide. Yan, McMaster slide. So it contains grid. So it allows us to count the eggs per gram, or oocyst per gram, or cyst per gram, or larvae per gram. So it is for quantification. So if you want to standardize their test, gumamit ka ng McMaster technique. Yan. We also have mini Flotap technique. Plus, if you want to also standardize, if you want to make your count very quantitative, yan, and you could repeat it many times, pwede tayong gumamit ng mini Flotap technique. So it's really easy, class. So my source for the different tests is Bench Aids for Diagnosis of Intestinal Parasite, WHO 2019. Yan, class, kung may mga tanong lang kayo. So class, here in this Flotap container, parang para sa akin yung mukhang lalagyan siya ng pangkulay ng buhok. So you will add your flotation solution. Yan. So put it there. Yan. And a specific amount of stool. Yan. So nilagay mo ng flotation solution. You should measure out the stool kung ilan lang yung kasya doon sa Flotap container natin, yun lang ilalagay mong stool. Then you're going to cover it and you're going to pump it. So the pumping motion is just a way of homogenizing it. You're just mixing it with the flotation solution. And so yun, gaganon mo itong nasa gitna. Then you're going to place a pipette. Mula na naman talaga. You're going to, parang a disposable pipette tip. Yan. And you're going to open it. And you're going to drop it in the reading discs. Yan. So it's not as parang very labor intensive or very detailed intensive intensive na paglagay as compared to your Neubauer. Yan. So lalagyan mo dyan sa two sides, and you're going to twist it so that some of the rest of the reading this would have stool as well. Yan. So that's your mini Flotap, and you can now focus it under the microscope. So it's a very accurate qualitative, quantitative diagnosis. So if you want to be really specific with your test and you want to have repetitive, you want to repeat it again and again. So you could use mini Flotap technique. Yeah. So class, that's our discussion today. I'll see you again. Bye-bye.